Low back pain is extremely common in all age groups, but it is highest within people in the working age. Most low back pain is not a sign of damage or disease, although it can be highly disabling and distressing. In many cases, it is completely acceptable to work despite having pain, but sometimes it can be necessary to stay away from work despite having a benign back pain. In such cases, the aim of the management strategy or intervention is to return to work, and in most cases, this is done best by gradually returning to work even before the pain has disappeared. In a recent systematic review published in the Cochrane Library, researchers compared studies of more than 30,000 workers and analyzed the influence that expectations might have on return to work. The researchers looked at three variations of expectations. 1. How long a worker on sick leave expects for the pain to last. 2. How long a worker expects to be on sick leave before he or she can return to work. And 3. If they expect that physiotherapy or other treatment will benefit them. The study shows that a positive expectation of recovery increases the chances of returning to work. Furthermore, in none of the studies, positive expectations were associated with worse outcomes. In essence, this means that having positive expectations is a positive thing with no risks attached when it comes to being able to return to work with back pain. The authors suggest that expectations of recovery may be a therapeutic target, and that helping a person to have more positive expectations of their own recovery may actually help them to recover. The study doesn't show how to change perceptions, but other studies have found that pain education may be one way to reconceptualize what pain means for the individual. If you want to know more about work-related pain, check out Prevent for Work on Facebook and YouTube.